Ask you a question about these large numbers of people that are in isolation at the moment. You yourself say that we have to live with COVID. How is that when we've got thousands of people that could potentially go into isolation over Christmas with the current rules that we have, considering how many Christmas parties there are, even if they're fully vaccinated?
Well, it's very clear that the purpose of the change today is to ensure that we reduce the definition or the capture of those people as close contacts. And as Dr. Chant has set out, from this point forward, a close contact will be defined as somebody who is in the household or somebody who is often in the household, so a partner of someone, or in addition to that, a circumstance which health deems to be a high-risk circumstance. So that will reduce the amount of people in isolation for that 7-day period, so that they will only need to only be required to have a negative PCR test. It's sensible. It's not that complicated. We'll continue to work very closely with health. We'll work through those people who are currently in isolation, and for those people who don't fall within this change, then they will just simply need a negative PCR test, and that is a sensible approach in the circumstances. The other point I want to make, which was remiss of me not to mention earlier, and that was in relation to the rules that are still in place. In circumstances where you do have COVID and you're required to be in isolation, or you are deemed to be a close contact and are required to be in isolation, those rules aren't there for the sake of it. There are substantial penalties in place. We want to make sure that we continue to put downward pressure on the hospital system, hospitalisations and ICU presentations. The best way of doing that is taking personal responsibility but following the rules that are in place. We aren't putting these rules in for the sake of it. We are learning to the question to live alongside the virus. Yes, case numbers are increasing. We always said case numbers would as we opened up our state. Ultimately, the key to that has been vaccination. And for those people who are vaccinated, we want to reduce the capture of people who would generally, under the past circumstance, be required to be defined as a close contact. And I think it's pretty clear.
Suggested figures of up to 25,000 cases a day by January. Are you concerned by that modelling? And is that what living with COVID looks like? And we will be living with 25,000 cases a day potentially?
Look, we've seen a number of models over the course of the pandemic. What the Health Minister has clearly pointed to is if you're looking at a doubling of cases between every 2 and 3 days, then we will see a substantial increase in cases. I know the media wants to lead on cases. Please also report this evening on the ICU numbers, on the hospital presentations. They are just as important. I have confidence in our health system, complete confidence. We've invested record amounts. I know that our health system in New South Wales is stronger than any of the other states. That is the reason, while through the entire pandemic, we've been able to open up more than other states. That is the reason why other states have closed their borders. We trust our health system here in New South Wales because we have invested record amounts in it. Also, I have complete confidence not just in our health system, but in the great people of New South Wales, the record testing, the record vaccination rate that we have in our state, and now boosters. And if everyone can continue to go and get boosters, then yes, as case numbers will increase, and they will increase, they'll increase tomorrow and the next day and the day after that. We need to learn to live alongside the virus. I want to instill confidence in our people that we can do that. And if you look at the ICU presentations, there are 24 across our state.